Welcome everyone to our information session about the online master's degree program in epidemiology at the University of Louisville. Welcome, thank you for being here today. I'm just going to give an overview of the program, talk about some of our classes and our faculty, some of our student experiences, talk about what's great about Epi, and then I have a list of frequently asked questions. And of course, feel free to ask questions anytime. You can put them in the chat, and we'll also have time at the end where I'll open it up and you can ask questions, through this virtual method here. All right, I'm going to share my screen, take you through some slides. Okay, so hopefully you are all at the right place. You want to learn about getting a Master of Science in Epidemiology completely online at U of L. So epidemiology is the fundamental science of public health. We investigate who gets disease, what kinds of populations, how do they acquire it, why are some populations more vulnerable than others to get certain diseases, what are the prominent risk factors for disease, and how do we figure that out? How do we figure out what the risk factors are? So it's like a investigation, it's a mystery. You're a detective, right? Figuring out what these risk factors are. And we also talk about how disease can be prevented and talk about how to do studies to study the effectiveness of preventive factors. The thing that is great about epidemiology is that it's very quantitative, it's scientific, it's logical, it's evidence-based. So how can we best design these studies on human populations to answer these questions? So we don't study rats or mice or guinea pigs or fruit flies. We study people, which can be messy a little bit because it's not like you can put them in a lab and experiment on them. So a lot of times we're just doing observational studies, watching people, taking surveys, taking measurements, and trying to figure out if the associations that we are seeing between maybe a risk factor and a disease, is that just correlation? Is it spurious? Or could it actually be causal, where the risk factor causes disease and preventing someone from being exposed to that risk factor may then prevent disease? So it's a fun puzzle to try to figure out. Epidemiology is still today a great career. It's still one of the fastest growing professions with a projected increase of 19% over the next decade. The median salary for a master's degree is around $80,000. And where can you get a job? You could get a job in the health department, for a federal health agency, for a medical center, either private or academic, an insurance company like Humana, pharmaceutical industries like Pfizer, energy and chemical industries. We have one former MS student working for a food safety company, for example. But of our MS graduates, we've had this program for a long time. It was in person for many years, and then we switched it to being fully online in 2024. So we have had quite a few graduates over the years, and we're about to have our first group of graduates from our online program graduating this summer. That's going to be very exciting to see where they go and what they do with this degree. But of our graduates, 30% do just go straight into the workforce, working for industry, medical research, or consulting. 40% went on to get a PhD in epidemiology to meet their career goals, and 30% went to medical school because public health and medicine go hand in hand. Just some nice photographs of our faculty. So we have some of our online MS instructors pictured here. I teach statistics, and I'll teach the culminating course where you'll do your final research project. Dr. Dupre, next to me here, teaches the epidemiologic methods course. She's a real expert in causal inference, how to figure out if X causes Y or if X is just correlated with Y. Dr. Rick Baumgartner teaches 3 of our classes, I'll talk more about him in a minute. And here's just a picture of us being collegial with our students, going to a U of L football game. But for our online students, some do come from Louisville, but most actually do not come from Louisville. They're from all over the United States. Our faculty highlight for this information session is our chair, Dr. Richard Baumgartner. He was recently noted on social media as being in the top 2% of most cited researchers in scientific peer-reviewed journals. He's got over 200 scientific publications, and his expertise is really in cancer, nutrition, and environmental epidemiology, but what he's really known for around here is his love of history. So he teaches the following courses. He teaches theoretical foundations of epidemiology, which does include a rich historical perspective of epidemiology, going back thousands of years even, and important turning points in history in epidemiology. He also teaches environmental epidemiology and clinical epidemiology. So this program includes 10 classes for a total of 30 credit hours, and it can be completed in a minimum of 4 semesters. And you could even go all the way up to 10 semesters if you want to just take 1 class per semester. So we have classes offered in the fall, the summer, and the spring. And you would work with your advisor, it's probably going to be me, to figure out the best schedule of classes for you. Here's some quotes from some student evaluations, which I pulled out because I think that pulls out the strengths of these classes. So one of my students said, asking questions in this class has been very straightforward and pleasant. Me, as well as other faculty in the program, are very, friendly with our students. We email back and forth. We'll answer questions as we're available, which is, usually within 24 hours. And we really care about our students. So that's what makes this program special, is that we care about our students, even though you're only virtual to us, but we care about you anyway. We want you to do well. We don't need you to be here in person. So we will meet with you virtually if you would like to. Another quote, this class is extremely well organized and thought out. So we put a lot of time into developing our curriculum and our courses, and we worked with the Delphi Center for Teaching and Learning, which has expertise in how to appropriately deliver online materials, and they helped us develop these classes. Most classes are a combination of videos, notes, and problem sets, papers, projects, and most classes also include some kind of discussion board where you can interact with your fellow students. Okay, so this is an example of a flight plan where you'd be taking 2 classes per semester. And I'm just going to check the chat really quick. Ariel, have there been any questions so far?
Nope, no questions yet.
Okay, thanks. I'll just check back in once in a while. So here's an example of a flight plan. In your first fall, you will take the 2 core methods classes, statistics, which we use all the time every day, and epi methods, which forms the basis for how we conduct our studies and what we can learn from them. A typical next spring would be the theoretical foundations for epi class and survey research methods. So we have a professor in our department, Nick Piper, who he works with eating disorders and social and behavioral epidemiology, and he's an expert on how to conduct surveys for epidemiologic studies. So you will learn from him. Then we have biology of disease taught by Dr. Brian Gwynn, who has a PhD in epidemiology and is also a registered nurse. So he has a medical background as well as the epidemiology. Then you'll take study coordination skills for epidemiologic research. That's taught by Dr. Stephanie Boone, who is currently the principal investigator for Kentucky for a huge national study called the Rural Cohort Study. So she'll be using her experience in the Rural Cohort Study, where they're studying disease and the disease process in Americans who live in rural areas. You'll learn directly from her about how she help to develop the study and how she's running that study. You'll take computational epidemiology with R. So you may have heard of R. It's a programming language. And one of our professors, Dr. Tashira Ali, is an expert in R, has been using it for a decade. And one of the quotes on the previous slide was about her and how nice that class has been developed. You'll take environmental and occupational epidemiology with Dr. Baumgartner. You'll take computational epidemiology with SAS, which is my preferred programming language, with me, and clinical epidemiology. And your course schedule might not look exactly like this, especially if you don't want to do 2 classes per semester, but you'll work with me to figure out a flight plan that would work for you. Like I said, you could do 1 class per semester, maybe throw in a second class here and there. There are some semesters where you'll be able to take 3 classes if you want to take that many. To apply, you need to apply through the U of L Graduate School with transcripts, your CV, a personal statement describing your background and your personal interest in epidemiology. So why epidemiology? 2 letters of recommendation, and the strongest ones we found come from academia, like your professors, although we do also see good ones from employers. Undergraduate GPA of at least 3, official transcripts of all degrees, and this is the one that most people have questions about, excuse me, college algebra or higher level math or statistics. We're just looking for some evidence that you will be able to succeed in our more quantitative courses. So we'd like to see college algebra or higher level math or statistics with a B or higher as shown on your official transcript. Yes, okay, applicants with an undergraduate GPA of 2.75 will be considered for provisional acceptance, but you need to maintain 3 once you get here. This program is open to international students. It should be noted that students will not be issued a visa for this program because the program is completely online. And here are the requirements if English is not the primary language of instruction in the home country. Tuition is $850 per credit hour plus a $10 fee per credit hour for online courses. So I guess really that's $860 per credit hour. And there's the entire program is 30 credit hours. There is a military-friendly tuition rate of $250 per credit hour. So you would go to this website shown here. You can find it just by Googling apply U of L graduate school. And the application fee is $65. Okay. Any questions yet?
Looks like we don't have any questions. I see Alex is typing, so Alex might have a question.
Okay. I have lost my little box. Okay. So some frequently asked questions. How is the material delivered? It's delivered through a course delivery system called Blackboard. Each course contains modules, usually they're on a weekly basis, video lectures, readings, and assignments, and group work or a group discussion is also a component of some of the classes. For fall and spring, the course length is a typical semester like you would have if you're going to school in person. So it's 15 weeks long. Summer semester is only 10 weeks long. So it's a little bit shorter and a little bit more intense because of that, because you're still getting 3 credit hours. So it's the same amount of credit as a fall or spring class. You can attend part-time, you can attend full-time sometimes. We don't promise that you'll be able to attend full-time every semester because the program is only 30 credit hours and not every class is offered every semester. But you will at least be able to attend part-time every semester and full-time some semesters if you choose to. but the minimum number of semesters to graduate is 4. So if you start this fall, the earliest you'd be graduating is next December, December 27th. The application deadline is July 1st. But we do review applications as they come in. So if you want to go ahead and put your application in, we will review it and get back to you usually in about 4 to 6 weeks. So independent research. So one unique thing about this program is that there is no formal thesis requirement, but there are elements of research covered in the classes, and PHEP 628, that class within it is there a culminating project for the program where you'll work with the professor to identify a research topic among several possible data sets that you'll be provided with. You'll come up with a hypothesis, write a background, do a data analysis, write a discussion, basically make a scientific write a scientific manuscript to address a hypothesis of your choosing. It is an option to add an independent study, but you have to arrange that with the professor on your own, and it's not part of the degree program, but you could add it on top of the degree requirements if you were motivated to do so. The strength of the program, it is fully asynchronous. There is not one synchronous meeting or exam throughout the entire program. There's a big emphasis on methods and study design, those quantitative skills, as well as programming in 2 different languages, SAS and R. All the professors in the program have a doctoral degree in epidemiology and are full-time. And in terms of the content, the strengths of the faculty of the department, we have faculty who are experts in chronic disease, environmental epi, infectious disease, genetic epidemiology, social and behavioral, and maternal child health. Is financial aid available? You can go to louisville.edu, online tuition, click on financial aid or scholarship to learn about applying for financial aid. The thing about financial aid is that you must be enrolled in at least 4.5 hours to qualify to apply for financial aid for a particular semester. So as long as you're enrolled in at least 5 hours, you can apply for financial aid for that semester. Okay, your turn. Questions? I will end my show here.
Looks like Matthew has a question.
Go ahead, Matthew. Okay, I finally managed to open the chat. Okay, thank you, Alex. For MS students. Okay, that's a good question because nobody has actually graduated from the online MS program yet. Everyone who's graduated from our MS program did the in-person version where a thesis was required. So I can't answer your question yet. We're hoping that the project, which will be done, in a self-directed way as part of the final course, 628, will give the student a thesis-like experience. Yes, but I'm not sure yet if the lack of the thesis will prevent you from getting into a doctoral program. I can say, because I also, teach in the doctoral program and review applications, that usually we're looking at the student's potential and more of the courses, the transcript, the recommendations. We don't focus really on, or we don't place a priority on their previous research accomplishments. So that's, from my lens as someone who reviews doctoral applications. Why would someone apply to the MS instead of a PhD? So a PhD is a longer commitment. It's usually 4 to 5 years. An MS is typically not as competitive to gain entrance into, so that's another reason. So if you're not sure about this career path, or you're not sure you would be accepted into a PhD program, an MS might be a good pathway to, number one, figure out if this is the right field for you, and B, if you don't have a stellar background up to this point, it could be a chance to strengthen your background to prepare yourself to apply for a PhD program. No problem. Yes, we do have students working full-time currently who are enrolled in our online MS program. One class at a time is a good way to go if you're working full-time. So I hear. Although I think I have a couple students who are working full-time and doing 2 classes at a time, but you really have to be dedicated, in my opinion. Probably those students may not have a lot of like external responsibilities in order to work full-time and, take 2 classes. That sounds like a lot to me. The classes vary in the amount of time that will have to devote to them. So the methods classes tend to be, more of a time commitment than the substantive classes. So that's something to think about as well when you're registering, and I can guide you on that when you decide what you're going to take every semester. Yes, I think it is realistic to have a part-time course load and work. Very realistic. Advantages of an MS to an MPH. MS is a research degree and it's more geared toward a research career. An MPH is more of a practical degree, and an MPH is more broad and less deep, basically. An MS is deeper. You're going to go deeper into epi methods and statistics and how to actually conduct epidemiologic research. You're not going to learn that in a lot of detail in an MPH. So an MPH, if you're planning to get more of a practical, hands-on type job, maybe public facing in a public health department or in health education, then an MPH might be a better route for you if you're more interested in that kind of thing. MS is definitely for the research minded. It is completely okay to not take 612 and 618 at the same time. So we have several students already we know are going to start this fall. They're just going to take 612 in the fall and then take 618 in the spring. Other questions? These are all really good questions, so thank you for them. Okay, it's getting quiet. Ariel, did I miss anything? Oh, Meredith's got one
Nope, I
more.
think we covered everything. Unless Meredith has a question. Looks like she's typing.
You're good. Okay. All right. Well, thank you everyone for joining us today. And oh, no problem. Hopefully I will, hear more from you, and feel free to send me any questions about applying to the program, or if you have any questions about the program. I am here, and I'll get back to you as soon as I can. Thanks, Kelsey. Thanks, everybody. Great. Thanks, Matthew. Bye.